Today's Easy 99.1 presents South of Boston, a weekly discussion of the happenings, business, and community events from Quincy to the South Coast and beyond. Any opinions expressed are those of the host and guests and do not necessarily reflect those of the ownership, management, or staff of today's Easy 99.1. It's South of Boston with this week's host, Pat Carroll.
Well, good morning, and in a kind of departure from what we usually do here on South of Boston, I would like to redirect the show just a bit today in order to be responsive to a recent local tragedy. I'd like to call attention to a friend in need, someone who needs our help, and in so doing, perhaps evoke a little of the true spirit of Christmas and what it really is, helping those in need and maybe even making some small miracles happen. Very recently, there was a fire at Highcliffe Senior Housing Complex in North Plymouth, and thankfully, miraculously, even no one was hurt or killed, but one lone elderly woman lost everything in this fire, including a place to live. My guest this morning is a very kind and caring woman, someone who wants to lend a hand when help is needed, and we're hoping that her infectious and generous spirit will inspire you and lead others to lend a hand as well. Meet Maureen Banks. Hi, Maureen.
Hi, how are you?
I'm good. How are you today?
I'm well, thank you.
So, Maureen, how did you first come to hear about this fire?
I saw a piece on the news about a fire at a senior housing complex in Plymouth. And because I work with elders, it really drew my attention. And I was very concerned that when elders who live in a senior community such as this lose things, that they may not have the resources to replace them. And so I reached out to the Plymouth Council on Aging and asked them if they needed any help. And to my surprise, they needed a lot of help, as no one has stepped forward other than the Plymouth Council on Aging. The Red Cross initially gave help, and Old Colony Elder Services has been trying to help. But those groups have limited funding also. So I reached out to people in the community to ask for donations of furniture, bedding, pillows. She left the apartment without even her shoes, so she literally has nothing. Unfortunately, being this time of year, people are kind of caught up, and for some corporations, apparently it's the end of the year, and so they don't have any charitable funds.
And we won't mention by name, by the way, the corporations.
No.
No, I understand that, but we'll just go right ahead. I'm sure that if they were in a position to help, that they would, as they have done for other people in the past. So I have working with my company, which is a home health company that has offices all over the place, and we try to give back to the community. So I gathered my office staff together and asked them if they would be willing to do a community project to help out this woman, and they were all gung-ho. So and my hairdresser, actually. God bless the hairdressers.
Right. My hairdresser went out and bought pots and pans, a toaster, some dishes and dish towels, and brought them to my office. And, none of us know this woman. I don't know this woman. She's not a client of mine. I think it's the right thing to do. It's truly the spirit that I think we should all embody as people who live in a community. Think if it was your mom and she lost everything and you weren't in a position to really help, but you knew your mother needed everything. What a terrible feeling that would be. So I would just like if people could reach out and, dig deep, and come up with some kind of help for this woman. She has no clothing left. She doesn't have a TV. She doesn't have any type of clothes. All of her food. dishes, glassware, bedding, blankets, winter jacket, shoes, underwear, everything. It's heartbreaking.
And you had said to me that you were quite surprised that, now I think we all expect that this is where the Red Cross comes in or other organizations, and you had expressed much surprise, and not even mentioning some of the furniture places that you had gone to, or we won't go there, but you had mentioned to me your surprise at the lack of taking over of the, well, she was given housing initially, but now she had to be hospitalized because she's kind of taken a step backwards in the health, maybe stress or worries or whatever, which is very sad. But
Right.
And she will have a place to go when she's out of the hospital, but nothing in it.
Right. And initially, I was led to believe that the Red Cross would be giving her a voucher to get a bed. And then for whatever reason, and the Red Cross, has been stressed out by many disasters and fires and Hurricane Sandy and, all of those things. And they too depend on donations from the public. So I imagine that their funds were stretched rather thin. And I'm sure that they did what they could. But when those groups can't help anymore, then I think it's up to the rest of us to step forward and try and do what we can. I'm not in a position to totally outfit her apartment by myself, and I wouldn't expect anyone else to do that either. But I think if we pull together as a community and everyone does a little, then before you know it, her cup will runneth over. So I just really hope that people, can find it in their hearts and reach out. Maybe they know somebody who, has some things that are either gently used or new, or own a store that they could donate either like a gift card or something, so that she can go and buy clothes and shoes, because especially trying to buy someone else shoes, they need to try them on. So I just want to make sure that we get what she needs, so that, this was a tragedy that had to be horrific to live through, especially if you're of an advanced age, to try and get out of a building. The fact that everyone was evacuated safely is certainly a testament to everyone who worked so hard to get people safely out of the building, and the fire department and the first responders who were on the scene, and the Plymouth Council on Aging and the Red Cross and everyone who stepped forward. But now that the initial horror of the fire is done, now we're left with the aftermath, and the TV trucks are gone, and so we're on to the next story. And meanwhile, this poor woman, who through no fault of her own, it has nothing left. She needs help, and she never asked me for help.
Right.
I don't even know. I've never met her. I only know her first name, and I've been talking with a very nice outreach worker named Jennifer at the Plymouth Council on Aging, who has been fabulous in communicating and appreciative of any efforts to help. Certainly anything that we get that we don't need for this particular person. Maybe there's someone else who didn't lose everything, but, might have lost something. And there's always someone who needs, so whatever is given would not be wasted.
Absolutely. So it sounds like generally gift cards to, for toiletries or clothes and shoes would be most appreciated. Does she still need a bed?
She does still need a bed, to the best of my knowledge. I know that Old Colony Elder Services was working with a mattress store chain to try and get them at the corporate level to donate. And hopefully that will come to fruition. But she will still need bedding, pillows, nice warm blanket, a lamp, maybe 2 lamps, a dresser, a chest of drawers. Just think about when you moved into your first apartment and you took stuff from your parents' house, what you needed to get started, and then think about how you'd want your mother or your grandmother to live, and then think about the things that you would want them to have.
So at this point where I know there's not an account set up specifically at a bank, but you are asking that people can call you and if they have anything, they would make arrangements with you. And again, you are Maureen Banks.
Right.
And I'm hoping you'd like to share your phone number, Maureen.
Oh, absolutely.
So they can do that.
My work number is 617-773-0012, and our office hours are 8:30 to 5. My cell phone number is 857-939-2143. And anything that anyone can do would be more than appreciated. And even a word of encouragement would also be appreciated, because it will everyone's good wishes and everyone's warm thoughts will be passed on to this woman to try and make this tragedy a little less painful for her.
And again, if you were not able to write down Maureen's numbers, you can always call the station, WPLM, Easy 991, and I will certainly connect you with Maureen. This is really a wonderful thing you're doing. I don't know if you mentioned who you work for, and I think we should definitely say that you're a testament to your company. It's BAYADA.
Right.
BAYADA Nursing.
BAYADA Home Healthcare.
BAYADA Home Healthcare. Okay. And you're good folks over there.
Oh, yes. And our founder, Mark BAYADA, is a true believer in giving back. The director for this region is Maureen Hickson, and she is a real advocate for people in need. And she makes sure that all of her directors, of which I am one, she makes sure that we, keep our finger on the pulse of the community and what we can do to help.
Well, you certainly are, and I hope that you get some response from this. So Margaret, we're going to say her name, Margaret X, has a great new year. Thank you, Maureen. And once again, your cell number is 857-939-2143.
That is correct.
Thank you, and Happy New Year, everybody.